Let's talk about the pathophysiology of elder mistreatment. This can be described as when a caregiver intentionally harms or withholds care from a frail or elderly person. Elderly mistreatment is often described as a hidden problem because so few cases are reported. And our client who is at high risk for elderly mistreatment would be an elderly woman who's living alone or is dependent on others. Now, most of these cases do involve family members. Less cases are involved in mistreatment by a staff, like a nursing home. The reason why elderly mistreatment is unreported is because patients or witnesses minimize or deny, or they're just unwilling to report the abuse. This is due to fear of retaliation, maybe they're embarrassed, protecting family members, or they are unwilling to pursue legal action. Let's compare the risk factors of the abuser versus the client. Our abuser's risk factors are going to be that they're dependent on that client for housing or financial support, and they've probably had a history of violence. Abusers are often unemployed and may have substance use or a history of mental illness. Now let's look at our client's risk factors. These clients have an inability to perform their activities of daily living. This can be from neurological disorders like dementia, or maybe a psychiatric history like depression. These patients also lack social support, and they may have a history of alcohol use disorder. What are the nurse's warning signs for elderly mistreatment? Physically, our patient may have atypical abrasions, meaning not normal, lacerations, contusions, or fractures. I'm thinking of an example like cigarette burns. The nurse may also hear poorly explained injuries, like "my dad fell down the stairs." Sexual warning signs would be anogenital injuries or newly acquired sexually transmitted infections. Signs of neglect would include dehydration or malnutrition because our client's no longer getting food and water. They'll have poor personal hygiene and pressure injuries because their family members are not cleaning them or repositioning them to protect their skin. The nurse may also notice deteriorating comorbidities, like untreated diabetes. If our patient is now experiencing financial exploitation from their abuser, now they're not able to take their medications, they're not going to the doctor, they've probably missed several appointments, and they have unpaid medical expenses. What are nursing interventions for elderly mistreatment? The nurse is going to screen for suicide and depression and ask the client if they feel unsafe in their home. Now, this can happen a few different ways, whether they're coming in through the ER or if a patient is admitted to a medical unit. The nurse can also ask the healthcare provider for a social service referral. The nurse is also going to use their chain of command so that the appropriate authorities can be reported, like Adult Protective Services. The bedside nurse will be taking photographs and documenting all specific findings, such as bruises, wounds, or even measuring lacerations. And finally, the nurse will document statements by the client or anyone accompanying them for possible police evidence. Let's talk about preventing financial abuse. The nurse can assist the client by encouraging them to appoint a trusted individual that's going to oversee all their financial transactions and decisions. This is someone who could oversee the client's advance directives, their living will, or their medical power of attorney. Great job, you guys. You made it through elderly mistreatment and on to the next lesson.